Welcome to our conversation today on vaccine requirements, public health, and your employees. I'm Jill Meyer, the President and CEO of the Cincinnati USA Regional Chamber. Thank you for being here. Joining me today, our partners and co-hosts of this event are the African American Chamber, the Greater Cincinnati Foundation, the United Way of Greater Cincinnati. So a personal thank you to Eric, to Ellen, to Moira for your leadership, and a big thanks to the teams at each of these organizations who really have worked tirelessly to support our community over the last 18 months. So at the Chamber, as I hope you know, we have a long history of providing critical resources and information to our region. And we also have worked really hard over the past year and a half to equip our business leaders with valuable resources to help all of you lead, especially in conditions as unpredictable as we've been experiencing with COVID. So our goal always is to grow the vibrancy and the economic prosperity of this Cincinnati region. And a part of doing that is making sure that we have healthy employees and customers. A region that is economically vibrant, of course, is one that is also healthy and safe. Before we get going with our conversation today, I do want to flag for you two important pieces of information. First, we are providing, and we're happy to announce this, that we're providing a new round of direct support to the small business community. Now in our second year together, the Cincinnati Chamber Foundation and the Duke Energy Foundation are partnering once again to invest $75,000 in the form of small business relief grants to support women, veteran, and minority-owned small businesses throughout the region. Like in the past, these grants will provide financial assistance to help businesses recover from the economic effects that have been brought on by COVID. It goes without saying, we are so grateful to Duke Energy for partnering with us. This is a critically important effort to provide further relief to those businesses that still remain under-resourced. So if you are, or if you know of a business that might be that might qualify and be interested, please tell them to go to www.cincinnatiChamber.com/Duke Fund. The applications are due September 17. Again, that's cincinnatiChamber.com/Duke Fund. The second thing is that we know, and you know now, that government has had a larger role in all of our lives in the past 18 months. In many ways, we should be grateful for the governmental response. We've had PPP loans, health information delivered directly from the governors across the region, and support for small businesses and restaurant programs from the counties and cities. Many of you have taken a keen, and some of you a new, interest in what government does on a daily basis to support you, to support your business, your employees, and this whole community. And so I want to be sure to share with you that on Tuesday, October 31st, so not too long from today, we're hosting our Regional Government Day at the Chamber. There are just a few remaining spots open as we have limited headcount due to COVID, but the program features people running for Cincinnati City Council and Mayor. Elected officials will be with us from Claremont County, Warren County. Our judge executives from Northern Kentucky will be with us, and we'll have additional government guests from the city of Cincinnati and Hamilton County, Ohio. It is always a great day. It's filled with lots of valuable connections and information for you. So if you haven't yet, please register at cincinnatiChamber.com events, or I think the chat will have a direct invitation in there for you to click on as well. All right. Now let's get to our program and the reason that you're here. And I think, again, we could all agree that the timing for this conversation could not be better. With the Pfizer vaccine now fully authorized and officially proven as safe as any vaccine in the United States, leaders everywhere are considering next steps regarding vaccines. As we get into this discussion, I want you to know that, like you, we have been thinking about this long and hard at the Chamber as well. And I'm proud to share with you that after doing our analysis, we announced earlier this week that the chamber will require all of our employees and vendors entering our private workspace to be fully vaccinated by October the 1st. I'm so grateful to our leadership team and to our board of directors for their guidance and their support in this important decision. As you may suspect, this was a decision not made lightly, but it's a decision that we made, and it's a decision that we know many of you are considering. It might be right for you and your workforce, or it might not be the best next step for your company. Either way, the most important thing that you can do is consider the issues, the impacts, and the potential guidelines that are right for your business. As one advisor guided me as we were considering the chamber's decision, he said, define your why, and then defining your how will come a little more easily. So that's what today is about. This is not a commercial that you should do this, but this is really a way to give you some guidance and some parameters to help you think through this really tough question fully, and to get your questions answered rather from experts in this space with the experience to give you that guidance. So as we shift how this is going to work, let me briefly introduce each of our panelists, and then I'll ask them to say a few words in the order that they were introduced. So panelists, remember who spoke before you, and when that person finishes, it will be your turn. We're going to post their full bios in the chat, so dig in for further information about the wealth of expertise that you have with you here today. I'm excited to start off with Debbie Hayes. Debbie is the CEO of Christ Hospital. She joined Christ in 1987 and has progressed her career through roles from nurse manager to chief nursing officer to chief information officer, chief hospital officer, and now as their CEO. She has really done it all within the walls. Debbie is a true leader and a trusted hospital executive who has helped our region recover and get to the point where we are right now in the COVID pandemic. Next up is Deana Taylor. She's the Vice President of Administration for 3CDC, where for the past 5 years, Deana has led all HR and IT needs for the organization. She earned her JD degree from the Salmon P. Chase College of Law, and before joining 3CDC, she led the Human Resources Department at Lighthouse Youth Services. She is so deeply connected to this community. She's on the board of ArtsWave. She's been a true leader at 3CDC in getting its critical response to the pandemic right, which was really important to our local economy. Thank you for being here, Deana. Next up is Chadeckhart. He is a member and the healthcare industry team leader at Frost Brown Todd, my alma mater. Chad works with private and public companies and healthcare entities on corporate law issues. He's led mergers and acquisitions, worked with not-for-profits on governance issues, and he has handled countless HIPAA privacy matters. Chad's partner, Jeff Lindemann, is also with us. Jeff is a member and he's the practice group leader for Frost Brown Todd's whole labor and employment group. Working out of the Columbus office, Jeff works with hundreds of businesses across the country, from healthcare to manufacturing to hospitality and everything in between, on issues related to labor and employment, workers' compensation, and other general employment matters. Thank you, Jeff. Kate Schroeder is the Interim Chief Strategy Officer for the Health Collaborative. Since January, Kate has been working on the vaccine rollout and is helping our community get to the 62% vaccinated where we are now, and she will help us get even further. For more than 12 years, she worked as a senior executive in public health at the Clinton Global Health Initiative. Kate's experience bridges policy and politics. She's worked at City Hall, she's worked on the Hill, and you may recognize her name from 2020 when she was the Democratic nominee for Congress in the 1st Congressional District. Kate currently serves on the Board of Health for the City of Cincinnati as well. I will tell you that you have what you've already figured out. We have an all-star panel lined up for you. I want to make sure that I also note Kate will be joined and we'll introduce separately Kamaria Walton, and you'll hear from Kamaria. She's been working with us at the Chamber and at the Health Collaborative to give employers support that they need to get the vaccination access and information rolled out. She's also a recent Miami grad and a total rock star. So I know that you will be excited to hear new talent here helping the Cincinnati region thrive and grow. So what we will do now is I'm going to turn it to Debbie Hayes to get us started with introductory remarks. Each of our panelists will take a few minutes to talk to you before passing the baton to the next. And then my colleague, our Chief Strategy Officer at the Chamber, Brendan Cull, will join to bring your questions to the panelists. So thanks to all of you again for coming. Thank you for considering your critical role in our navigating through the hopefully a final end to this COVID pandemic. And on that, Debbie Hayes, take it away.
Thank you, Jill. And Jill, thank you so much for inviting me to be part of the conversation today. I see we have about 242 participants in the Chamber's offering today. It's an amazing group of people here to have this very important conversation. You know, since the very beginning of this pandemic on essentially February of 2020, the greater Cincinnati healthcare community has been doing everything in our power to ensure the safety of our patients and the safety of all of those who come in contact with anyone in the community, quite frankly, related to the COVID-19 pandemic. It is my hope that through this conversation today, you can have the opportunity to ask questions from me about our journey down this path. As all of you know, on August 5th of 2021, Christ Hospital made the decision, as did other organizations, healthcare organizations in this community, to require vaccination of all of our employees, all of our physicians, all of our staff, our volunteers, and all of the vendors who work within our organizations. Those independent decisions were made on the behalf of the safety of our patients and the safety of the community that we serve. I am very interested to hear all of your questions and will be grateful to provide you with any help that I can as you think about this very important conversation. And with that, Jill, I'll turn it back to you.
Thank you, Debbie. We will move on to Deana Taylor.
Well, thank you, Jill, and thank you for having me here. And it's nice to be amongst great leaders of our community. Since the beginning, we knew that we wanted to just try our best to continue as normal, whatever normal looks like. So we furloughed staff initially, but by June of 2020, we brought our office staff back, but with a staggered work schedule. So with that, it meant having everyone do a wellness check at the beginning. We got creative and had a QR code and touchless temperature tech checks and so on. And like I said, a staggered work schedule. But then once the vaccines became available, our new policy was that if you were vaccinated, fully vaccinated, you did not have to wear a mask in the office. So that was our way of tracking vaccines. So we were able to track vaccinations, and by the July of this year, we knew in our staff how many people had not been vaccinated. Fortunately, it was maybe 5 or 6 people that were not vaccinated, but making the decision was not an easy one. I know people think that it's easy to make those type of decisions, but when you're making a decision that affects someone, whether it's their livelihood, their personal beliefs, it's a lot of stress. But you know, we knew that, you know, we wanted our staff to be able to come to work and feel safe coming to work. They're going home to their families. A lot of them have young kids and you know, just elderly parents. And so the thing that we felt was it was our responsibility to just make sure when people came into our offices that they felt safe. And so I'm happy to say that mostly we're still 2 holdouts, but I'm hopeful that those individuals will be fully vaccinated by September 30th. And what we did, because we do a lot, you know, we not only revitalize or do redevelopment, but we also work and manage the civic spaces such as Fountain Square and Washington Park. Ziegler Park and Memorial Hall. So it was just important for us to be able to still be able to provide those events to the community, those free events, give people an opportunity to be outside and to be able to, still communicate and network with colleagues, but do it in a safe way. So when we made the mandatory vaccination policy for our staff, we also made it mandatory for visitors. So if you come into our offices and you have to wear a mask unless you do show your vaccination card. For our vendors who like our IT, our brokers and so on, we have their records on file as well so that we don't have to keep asking them to show their records. So again, it's not an easy thing to do, but it just feels necessary at this time to do it. And so again, with that, I will turn it, I think, over to Chad.
Yeah, thanks, Deana. I appreciate that. And Jill, thank you so much for asking Frost Brown Todd to participate in this important conversation today. And what I've learned from heading the healthcare innovation team for our firm through this whole pandemic is something that really reinforces a thought about law that, Jill, you and I used to talk about when you were at the firm, was really, how does legal fit into the business? And a lot of times when we're looking at perspectives from just the legal lens, we have one answer, but we don't really get the chance to see how does that one answer fit with respect to entire business. And so when you have to fit the legal answers into such complicated issues like the one we're talking about today, you end up with variations and modifications of how you're going to do what is the why, as Jill said. And so being a part of all these conversations, so with our clients throughout this pandemic, at first of the whole furlough issues, and then the testing and how do we reopen and loans, I mean, just all of the issues that have come up so quickly. And even today, we're talking about an issue of mandatory vaccination, and the business community is moving to some other issues. Like, Delta came out yesterday or a couple of days ago saying that they're going to increase a premium for employees who are unvaccinated, which, Jeff will let you know, sort of like flies in the face of some of the anti-discrimination laws that are out there. But how do we get to that? So what is the why and what's the how? And so there's a number of things we can talk about that, but it moves so quickly that we're just happy to be a part of being able to share the legal perspective, what's happened, recently with respect to mandatory vaccinations, to this conversation, so that you guys have a little bit of the general understanding of how the law is going to impact this much bigger, broader cultural decision for your organization. So I'm really happy to have Jeff with us. Jeff's an expert in this area. He sees so much of the employment law issues that come across, from our 15 markets and 10 states. And Jeff, I know there's been some recent cases with respect to mandatory vaccination that probably really helpful for everybody to know a little bit about. But I turn it over to you.
Okay, well, yeah, thank you all for the opportunity to participate, and thanks for setting this up, Jill. I think the biggest thing that I've observed throughout this pandemic is how quickly things change, and the biggest lesson that I've learned from that is how important it is to be nimble and prepared to change with it. That's the first thing. So everything that we say today, with the stroke of a pen by a legislature or governor or something like that, could change. And so it's really important to be watching your state laws, especially for those companies that operate in other states. Each state, may have its own rules and regulations about mandatory vaccinations. So you always want to be cognizant, not just of what's okay in Ohio, or federally, but what's okay in the states where you're operating. And then the second thing is just being prepared to be nimble. The second thing that it seems to me that I've seen with COVID is a lot of times lawyers get really, really rigid. And here's a rule, here's how we have to do these things. And COVID seems to be kind of a throwback to where people are kind of looking at, and judges are kind of looking at what makes sense and what's reasonable, as opposed to just, here's a law, apply to law, here's a law, apply to law. And we're seeing that in some of the guidance that's coming out about mandatory vaccinations. So for example, the EEOC, first of all, are you allowed to require vaccination of your employees? And the EEOC has said for employees who are working, at a location as opposed to working from home, it's not an EEOC violation. That's the position they've taken up till now. And so far, the court cases tend to be siding with employers on those issues too. There have been some district court cases out of Texas and Virginia that have upheld the employer's right to require vaccinations, and then Indiana University seems to be the kind of one of the leaders, not only as an employer but as an educator. And that recently the Supreme Court declined to peel their mandatory vaccination requirements back. So at least it's early in terms of the trends in the courts and in the government agencies, but at least early the trends seem to be that there's support for mandatory vaccination, as a general rule. Now, that doesn't mean that every single person, if you require them to be vaccinated, you just have a blanket policy and that's the end of the day. Title VII and the ADA still have some areas where employers are required to consider certain circumstances. Under the ADA, employees with disabilities, employers are required to accommodate those disabilities, and some employees who are subject to mandatory vaccination may have a disability-related reason for being unable to be vaccinated. Either whether it's an allergy to the components of the vaccine or some other medical related reason. And employers are still required to engage in the reasonable accommodation process with the employee and trying to figure out if there's a way to reasonably accommodate the employee's inability to get the vaccine. And that doesn't mean that you can't require, it may be that the employee might not be able to work in a particular job, or the job needs to be modified, but you are required to accommodate unless there's an undue hardship or a direct threat presented to the employee, to the coworkers, or to, if you're a hospital patients or visitors. There's also under Title VII a religious accommodation required. Some employees may have religious objections for various reasons, and that also requires an accommodation process. Although the standard for religious accommodation historically is considerably lower than the standard for disability-related accommodations. The EEOC's language is more than de minimis, but it is something that employers should be aware of and prepared to address. Another issue that can come up for those companies that have unionized workforces is the decision to require vaccination would be a wage hour term or condition of employment and may be covered by the National Labor Relations Act, and therefore employers may have a duty to bargain over the decision to require vaccinations, at least with respect to unionized employees. And there's also some law out there if employees get together and come in and raise complaints about, I don't like this policy. Even if they're not unionized, employees getting together to express grievances or concerns about wages and hours and terms and conditions of employment is also protected activity. So you want to be cognizant of those situations if employees come forward, being prepared to listen to them and not take adverse action against them simply because they complained. Those are some of the so those are probably the biggest legal issues that we've seen come up relating to mandatory vaccinations. The other thing that I think a lot of the clients are struggling with, and each company has its own culture, each company has its own needs and layout and who it serves. But a lot of this there are real practical issues for a lot of companies. It's very hard to find employees, and if you're rejecting a chunk of your workforce, that makes it even harder. So there's a lot of balancing going on, and I don't envy you all who have to make these decisions, because there isn't a perfect answer for every company, and that's probably the thing that we've learned the most during COVID is the need to be flexible, and I think that applies to these decisions and how you implement them as well. So that's my general take.
Thanks, Jeff. That's incredibly helpful. I'm Kate Schroeder with the Health Collaborative, and just want to thank everybody, all 246 folks who have joined today to be part of the solution. I will be very brief. In this region, 62% of those who are eligible, so 62% of everyone 12 plus in our 15 county tri-state region have had at least one dose. So that is very encouraging. I think the best data nationally and regionally in terms of how high can we get is somewhere around 85%. So there's been a hard sort of 15% of folks that say they will not get the vaccine, but we still have a lot of opportunity for growth between the 62% that we are at now and the roughly 85% that will likely be around the ceiling of how high we can get the rate. And really just encourage all of you. I think employers, as we all know, are incredibly trusted. They're a trusted resource. You have the ability to help increase our rate in this community. It's not just for protecting the safety of your environment, it is also for our community so that we can fully reopen and get our economy back. And the longer it takes us to get that rate up, the higher our sort of herd immunity level gets, because more and more variants like Delta come. So just grateful for everyone for being here today. And at the Collaborative, we have been a partner with the Chamber to provide resources for businesses, whether that's on-site vaccinations, on-site testing, having a clinician come and speak to your employees to answer questions. One of the key learnings is listening is just as important as educating. When folks have questions or concerns or are hesitant, listen, and that can really make a big difference. So with that, I want to hand it over to my colleague, Kamaria, to run through a couple quick slides on the employee survey that we did in this region with the Chamber.
Thanks, Kate. I'm super excited to be here today. I will be sharing this information starting with the next slide. So this employer survey was conducted the last week of July and the first week of August, and it had 119 employers respond to the 3 questions that I will briefly cover in this presentation. The first question was around the percent of employees and organization that were vaccinated. A large portion said that 90% plus were vaccinated, which was incredible. And around 8% sat around our regional average of 62%, within that 60 to 69% range. And then for the second question, it was around vaccination incentives. So around 20% said they were currently offering vaccine incentives, and then around 30% said they weren't, but were open to. And then for the third and final question, it was around interest and resources. A lot of employers were interested in free on-site vaccinations, free on-site COVID testing, as well as updates on the COVID vaccination. And then there's been an increasing trend in employee vaccine requirements, especially within the last few weeks. And we expect to see this trend continue, especially with the recent announcement of the full approval of the Pfizer vaccine by the FDA. And we're also seeing this trend in the greater Cincinnati region. Altria Senior Living was one of the first with its announcement of vaccine requirements earlier in the year in January. The Cincinnati Health Systems announced recently in early August their vaccine requirements for all staff. And Tyson Foods and ERS also announced recently their requirements for staff vaccinations. And then if you have any further questions or interested in any of the resources that I mentioned prior, please feel free to reach out to me. Thank you.
Thank you, everyone. I'm going to jump in here and kind of moderate the question and answer session. We've done a lot of these panels over the last 18 months, and I don't think I've seen a Q&A board light up quite the way that this one did in the first 25 minutes. So that's great. To the panelists, I will serve up some of these questions. Feel free to jump in. I will ask if I think that a certain one of you might be best equipped to answer. But let me start with, I'm going to try and group them together. So we won't go for every single one, but I'm trying to group them together in topics. And to anybody who is listening in and has specific questions, use the Q&A feature. I'm going to monitor that one primarily from now, and then the chat feature as well. But I prefer you use the Q&A so I can kind of keep tabs. I will say, Kate and Kamaria had a bunch of information about how they are willing to go out and talk to companies, bring vaccines, clinics to your offices and help in any way. And some of you are even asking about that in the chat. We'll put our emails in the chat. And so if you have questions or you want a group to come out and talk to you, that's what we've been doing in partnership with the Health Collaborative now for several months. And we will keep doing that until we get to that nice round 85% goal that Kate talked about. But let me say this first about questions. And for those of you who have made a decision on the panel to say, we are going to have a vaccine requirement, there's a couple of questions about how did you balance the decision when it comes to potentially losing employees. And I know both Debbie and Deana have made this call for your workforces. Obviously, maybe different kinds of organizations, but my sense is in the meetings, you probably had this conversation about what happens if someone decides not to do it and how will that fit into your operation. So maybe both of you could jump in about how that conversation went and how you got to where you are.
Sure, Brendan, I'll take a stab at answering that question. First of all, I want to acknowledge that this is not an easy decision. Maybe a little bit easier for those of us in healthcare, because for years we have required vaccinations of employees, staff, and others to be able to work in healthcare. So it really is just another extension of our long history of vaccination requirements. That being said, it's still a very difficult conversation because of the fact that this is a virus that's only been with us for about 18 months. And there are lots of opinions about the particulars of this vaccine. One of the things, obviously, that we are very concerned about, we do have an exemption policy, as many do, and we have a process for that, and I'd be happy to share that with anyone if they have questions, is about what would we do if all of our staff or a good portion of our staff were not available to us. One of the things that we all do as leaders in organizations is weigh the risks and the benefits, right? Well, I'll just share a number with all of you, and it's not one that I share lightly because it was very concerning to us when it happened. At one point at the height of the pandemic, healthcare organizations had in excess of hundreds and hundreds of their staff members that were not available to their workforce because of the fact that they had COVID or were exposed to people who had had COVID. So one of the ways for us to ensure that we have a workforce to be able to continue to serve the community is to make sure that we do everything that we can in order to make sure that they aren't afflicted with the disease that, quite frankly, now is turning into a disease of the unvaccinated. And so there is a risk benefit that we have weighed as we've made this decision, and also about how do we ensure the safety of everyone that comes into our organizations in the best possible way. So as we've listed those risks and benefits, that's really how we made the decision. And we will make alternative plans to deal with our business, just like we did in the height of the pandemic when many of our associates were out with COVID themselves.
And from our standpoint, I will echo what Debbie said. It was not an easy decision. Fortunately, when we made the decision, 92% of our staff were fully vaccinated. So it, like I said, was a handful that we were concerned about, and those handful were valuable to us and still are. So it was a matter of, man, I would hate to lose these individuals, but for the greater good of the organization, this is what we have to do. And, you know, we do, of course, make religious and medical accommodations as well. But it really just came down to, do we want to continue to do business? Do we want to continue to serve our community the way that we have been serving them? And how can we continue to do that as safely as possible? One of the things that I just tasked myself with doing is every week sending an update to staff. So they became used to a Friday email from me with just whatever I could think of. And some days it was just wash your hands and go home early if you don't have anything to do today. But they became comfortable with those communications. So when we made the decision, it was not a big surprise to, I think, many of the staff. We also had staff that thanked us for making that decision, but they weren't surprised because we had been deliberate about our communication throughout the whole COVID, and we'll continue to be deliberate about our communication as things change.
Thank you, Deana and Debbie. Let me go next to a conversation about incentives versus disincentives. And I'm gonna maybe call on our friends from Frost, but also Kate and Kamaria here too. A lot of companies have been doing incentives to get people to take the vaccine. I think some folks in our survey showed up and said that they have done that. And then somebody's asked in this chat about Delta, which is almost a disincentive. If you don't get the vaccine, you're going to be charged more for your healthcare. And so perhaps what you could do is address those kinds of policies. I'm looking for the exact question about Delta, which is asking whether or not you expect other industries to adopt that kind of a strategy. So I wondered if you might talk a little bit about those. Maybe I'll start with Kate, and then Chad and Jeff can jump in.
Sure. I do think there's a range of options. And as a parent, we all know that carrots and sticks work. And so with Delta, they noticed they were spending $50,000 for hospitalizations of employees with COVID. And as we know, like in Ohio, of the thousands of COVID hospitalizations and deaths that we've had, 98% of the hospitalizations are among unvaccinated, and 99% of the deaths. And so those expenses really are, and they're self-insured at Delta, and they're spending $50,000 per. And so they came up with this policy as a way, and there are legal technicalities around having a wellness program under the Affordable Care Act, where you can do things like that. And so I think that was their choice. I think other places are looking at options of mandatory testing on a weekly basis if you're unvaccinated. And I do think there, you know, it's not just a requirement or not. I think you can do other things that make it, you know, you can't come into the office and work, which I know some folks, remote is great, but when there's a lot of business being done in the office, that matters. And so I do think we see employers looking at a range of options.
Kate, I think that's right. It's really interesting to think about this. There's a couple different ways that the law deals with these. I'm going to let Jeff kind of chime in on some of the incentives, but with respect to the employee benefit structure that is being referenced with Delta and some others, there is an opportunity based on how every organization's own individual benefit plans are structured to take advantage of some variations that can be developed in a wellness benefit program. So there's anti-discrimination rules that come from HIPAA and that also come from the ADA with respect to how you structure those variations. But as a general matter, you can have some variations in costs associated with the wellness programs under the Affordable Care Act, as long as the variations don't expand more than 30%. Now, the problem that you get is that people have been doing this for a number of years, trying to encourage certain types of healthy behaviors And so they've already maxed out that 30% variation. So it's going to take some restructuring. So just because Delta does it doesn't mean that everybody can just turn around and do this. It's all built based on their own individual plans. So that's something that you really need to work with your employee benefits attorneys on to make sure that, do we have an opportunity to structure this? And if so, how do we go about doing that? If not, what do we need to do in order to have that opportunity, if that is really, the how to get to the why, as Jill was saying earlier. With respect to some incentives on just getting vaccinated, Jeff, I'm going to kick this over to you, but from a general perspective, there's some variations in what organizations can do to incentivize obtaining a vaccine on site, which Kamaria's survey showed us that a lot of individual organizations are interested in that, versus going to a third party in order to go and get that vaccination. And part of that is because of the exchange of information and the data and the health information that an organization is going to receive about its employees versus a third party. So Jeff, I think there's been a little bit of activity in the incentive space with respect to incentivizing individuals to go get a vaccination as sort of a ramp up towards maybe a possible, if that doesn't work, mandatory vaccination policy.
Yeah, the wellness rules kind of kick in here too, in the sense that if the incentive is viewed as too much, you've got some issues there. So if you say, like, if you haven't been vaccinated, here, we're going to give you $500 to go get vaccinated, that might run into some of these wellness rules that we talked about before, or that Chad and Kate talked about. Other types of incentives, I kind of like better, giving a leave so that somebody can go get vaccinated, giving days off, things like that. That a lot of employers have done that. That may have run its course at this point. And then the other thing to keep in mind on the incentives is, just the employee relations perspective of, wait a minute, I got the vaccine back in April. You didn't give me $50 when I got it. Why can somebody hold out? And the other perverse incentive is like, well, if they'll give me 50 now, maybe they'll give me 100 in 2 weeks. So you want to think through your incentives a little bit, and you want to find a way to incentivize people without causing rifts for those who've already done what they were supposed to be doing, and or supposed to be doing is kind of pejorative. It's we're already doing the things that you're looking to try to encourage.
Just a quick, oh, sorry.
Go ahead. Good.
I was just going to mention one other incentive that I think some companies are doing that's interesting is for those that get sick with COVID, you can use PTO if you're vaccinated. If you're unvaccinated, you have to use your sick leave.
Or some even go further and say you're not, once you run out of sick leave, you're just unpaid if you have to quarantine.
Right.
Well, yeah. For quarantines, which I think is we've heard of some doing. While I have Chad and Jeff kind of up, there's a few rapid fire legal questions that I'll do, and with the disclaimer that anybody on the call who is making decisions is always wise to check with their counsel. We've got two great attorneys on here. They are available to you. Again, their emails will be in here, so you can always reach out to them directly. But it's always good to not take specific legal advice from a webinar. I think you guys would say this is really helpful guidance, but worth checking into with a separate conversation. Thank you, Jill, for nodding at that. And okay, so the first question is related to HIPAA. And if you're on Twitter, everybody is a HIPAA expert now. Are you as a manager allowed to ask if someone is a manager or a company allowed to ask if someone's vaccinated?
Yes.
Yeah.
A
pretty
easy question there. Can you?
You should. I should probably caveat that a little bit. You should. Yes, the company is allowed to find out, but you should treat it as medical information and keep it confidential, as opposed to, having a list of the vaccinated and unvaccinated. But companies are allowed to ask.
And so if HR takes the information and asks in, someone asked if that should be shared with a a manager of direct reports? And it sounds like the answer there would be no.
Only on a business need type.
Yeah, and I think Brendan, why these questions are being asked is because, and why you framed it up as HIPAA, is because of the protection that's given to health information. And that rule applies to group health plans, clearinghouses, and healthcare providers. It doesn't necessarily apply to a manufacturing company. Okay. Now, a manufacturing company may have their own self-insured plan, and therefore the group health plan that they have does obtain PHI. So there's rules regarding that. So it's good to ask these questions, but there's an exception in the definition of protected health information for information that a covered entity, a healthcare provider or group health plan, maintains on its employees in its role as an employer. So a lot of employers will have certain, like Debbie mentioned, there's always been a vaccination requirement at the Christ Hospital. Schools have requirements with vaccination and others. There's drug testing. All of that is health information. It's not going to be protected health information under HIPAA in certain circumstances. There's an exception for it, but as Jeff mentions, there's state laws that are going to require you to keep that confidential as well. So I think I know where the question's coming from, and HIPAA's already worked through a little bit of that.
And Brendan, I'll jump in too from just a practical standpoint. What we found is, because we work in an open office environment and you have your coworkers who are wearing a mask, you can assume that they are the ones that have been vaccinated, because that's our policy, is if you're not vaccinated, you must wear a mask. And so as things evolve, you pretty much know who those individuals are but you don't know what reasons they are, whether it is a medical exemption or a religious exemption or what their reasoning is, but you tend to know who those individuals are just from a common sense standpoint.
Okay, next kind of rapid fire question. Could you conceivably have a vaccine requirement for new employees only?
Go ahead, Deana.
I was just going to say that we have it for a new employee. So to be a new employee coming in the door, you have to be fully vaccinated. So that's our policy as well.
Great. I think if I may have understood the question to say, could you not have a requirement for your existing employees and then add a requirement just for the new employees as they come in? Jeff or Chad, you want to?
Yeah, I mean, I can't think of a reason beyond, I can't think of a legal reason why you couldn't have that. It could be used, it's not like you're picking people out on the basis of, a protected characteristic like race or gender or something like that. It's new hires versus existing employees. So I can't think of a discrimination argument that could be made, assuming it's probably would be more of a morale type issue. But if you're requiring it of all new people, it's no different than any other type of policy where existing employees have been grandfathered in. So I'd have to think about it a bit, but my initial reaction would be I can't think of a legal reason why that would be impermissible.
Got it. Okay, one quick question on remote work. Could you say that a reasonable accommodation is 100% remote work if you wanted to do that? And that, if I'm understanding the question correctly, was if the person doesn't want to get the vaccine, they could say, then just let me work remotely. An employer, I don't think has to, but you answer, Chad or Jeff. Tell us how you square that.
That's a classic lawyerly it depends answer. Because I say that just because it depends on the job, and it depends on what the employer's requirements are. If the job is running a machine at a factory, I don't think you're going to pick up the press and move it to their house. And so the answer there is no. If it's a job that they can do remotely, maybe it would be a reasonable accommodation. But it depends on what the employer's expectations are and how that can be worked out. And and that's a big change that we're seeing. We're seeing it at FPT, and I'm sure a lot of other people here are seeing too, is, there is more remote work and Zoom and all of that now. And so you're going to see more reasonable accommodations, not just on the vaccine front, but for other disabilities where somebody might not be able to come into work. And they're going to point to the fact that they worked remotely for 18 months, and so they should be able to continue to work remotely. So it's going to be important for employers to be able to articulate why, if the person needs to be in the office, why they need to be into the office, and to engage in that interactive process that's expected under the ADA, to talk about, well, here's what we need you to do. And, just I'll just use FBT and lawyers, I have to go to court occasionally. Are you going to go to court? What are you going to comply with the rules there? How are you going to handle that situation? How are you going to handle client meetings? A lot of clients want to meet in person, and that's an important thing. So those are all things that are going to be part of the mix with the work from home, even if most of the time they can do their job from home. And it's going to depend on what the employer's expectations and what the employer's needs are.
Okay, one more rapid fire. There's about 4 questions on religious exemptions and how companies should handle religious exemptions. A lot of you are nodding on that, so I'm going to ask anyone to jump in. And then Debbie, I'm going to come to you too on a couple of kind of health-related questions on boosters and vaccines. So who would like to start with the question on how you're handling religious exemptions broadly? And there's a bunch of different ways that it's framed in the chat, but mostly along the lines of, how can you handle it? How do you track? What do you ask? Those sorts of things.
Yeah, I'll take a stab.
Okay,
Go ahead, Jeff. Go ahead, Jeff.
This is one of the hardest topics, because the ADA exemption, the disability exemption, typically rests on the opinion of a third party, a doctor or healthcare provider. So you kind of have somebody else, whereas the religious exemption asks, in part, you to look into the heart and belief of the person requesting the exemption. So it's very hard. And this is an area where I'm going to say, as more employers go to this is an area that's not particularly well developed under Title VII. I guess I'll say it that way. Religious exemptions for vaccine mandates are not something that's had a lot of litigation and in the past, and so there's going to be more things developed as these cases kind of go forward. So it's something that you have to watch for. But the first thing about religious exemptions is it does have to call to a religious reason for not wanting the vaccination. A higher power. It doesn't have to be I'm Catholic or I'm Jewish, or it doesn't have to be a specific religion per se, but it does have to have religious connotations to it. So it's got to be more than, I just don't want to put unhealthy things in my body or something like that as the religion.
Sorry.
Go ahead. I'll stop because I've kind of monopolized this.
No, Debbie, we appreciate it. Debbie, do you want to jump in there?
Well, the first thing, yes, thank you. The first thing I was going to say is, if you don't have your own counsel, please consider consulting with folks like Jeff and Chad, because it is a very difficult discussion. In our organization, what we do is we have a small committee that is made up of our HR representatives. We actually have a chaplain on staff here, so he is on that committee. And there are a variety of questions that we worked with our legal counsel to ask participants in the exemption process, if what the answers to those questions are. And again, because we've had the advantage of having these vaccinations be, not this one, but others over the years, we also ask them if they've requested religious exemption from previous vaccine requirements.
That's helpful. I'm going to stay with you, Debbie, for just a real quick question from the health perspective, because there's a handful of questions that have to do with antibodies and whether or not a person who has had COVID might be exempt from a vaccine requirement. With the, I presume the idea that, well, I've had it, so I can't get it again. You could probably speak to that. And then there's a couple of questions about what you're anticipating for boosters. Do you, well, it's a ways off for everybody, but I think people want to know, if we do this for the first vaccine, do you anticipate some sort of a requirement also for boosters?
Yeah, first, I'm not a physician, so I will not purport to be a physician. I am a nurse by background, as you all know, so I do have scientific, at least capabilities in my lexicon. Two things. If people are vaccinated, or if people have had COVID, they are not automatically exempted from the vaccine. In fact, the medical professionals are recommending that even those who have had COVID be vaccinated. There is a waiting period, and so I would suggest that if any of your employees have had COVID and are having that question, ask them to speak to their primary care providers, or certainly if they would need an infectious disease specialist to answer specific questions about their case, we certainly can make our infectious disease specialists available to them, because that's a common myth out there that if you've had COVID, you cannot get COVID. The second question is that on the boosters, what many have probably already seen is the recommendation for those who are immunocompromised to go ahead and get the vaccine. That is related to the fact that sometimes immunocompromised individuals do not mount the response that one would expect from having the vaccine. And so medical professionals are recommending that those with immunocompromised status go ahead and get a third shot. It's not really a booster, it's actually a third shot because of the anticipation that their own immune system didn't kick in like it should have, or as powerfully as those of us who might not have an immunocompromised situation. As far as boosters for the current variants of the virus, that is still unknown. I do know, obviously, that the FDA had talked about approving the current vaccines for boosters. Our medical professionals would say the data is still not clear about whether you need a booster right now, unless you have certain underlying health conditions, such as the immunocompromised status that I talked about before. We do anticipate that in the future it's possible, but it is not necessarily the widespread recommendation of all medical professionals at this point.
And last health question, we're at 12:59, so we're going to go just a few minutes over because I want to get a couple more questions in, and then I'm going to give you a couple directions on how you can ask more questions too. Last question for Debbie, a couple of questions about, since you're speaking the language, about women who might be exempt because they are either pregnant or trying to get pregnant. Is there specific advice there? Obviously, that's going to be between a person and their doctor, and then if a company were to consider a requirement. But how did you look at that at your organization?
That's a really important question. Here's what I would say to that. All established national medical communities, the American College of Obstetrics and Gynecology, the American Association of Infertility Physicians, and I could go down the list, more than 60 to 70 medical professional associations have all recommended the vaccine for their patients. Each individual should have a conversation with their particular physician. But one of the things that I think is so powerful is that all national medical organizations have either strongly recommended this or recommended that organizations require the vaccine of their particular areas. And that's because the clinical data on the safety and efficacy of this vaccine is greater than any medication that's ever been studied in the history of medicine. Kate, you can give me the vaccine numbers, but I believe now across the world, it is about 6 billion doses of vaccine There has never been ever a study this large in the history of modern medicine. And so as the data has become available in reputable scientific journals, each and every one of those medical professional organizations is recommending that. And in fact, the ACOG for pregnancy, the American College of Obstetrics and Gynecology, is strongly recommending that all of their patients get vaccinated, because not only does it protect the mother, they are also now reporting the protection to the fetus.
Thank you. I appreciate that answer. It's great. There are so many questions in this chat that I really want to be able to get to. There's questions about masks, and there's asking for speculation on some of the lawsuits that have been filed. I can't get to all of these, but we would encourage you, again, Chad and Jeff are going to leave their emails in the chat. And so if you have a specific legal question about, am I at risk? Is my company at risk? How should I think about this? They are great resources. You can reach out to a counsel if you already have a counsel. Obviously, we've got two great ones on here. And then if you have specific questions for us, we also we'll do our best to connect you. Let me ask one last question, because there's a couple questions about testing. And Kate, I know that the Health Collaborative has been working throughout the community when it comes to testing protocols. Question about, is there anything that might be, are we running out of tests? How's the Health Collaborative helping, and how can you help an employer who wants to think about testing employees who are not vaccinated?
Yes, so there is tremendous testing capacity available throughout our community. All of our retail pharmacies offer it at testandprotectcincy.com. There are free community public testing sites with PCR testing available. And so encourage folks to go there. Testing is critical. It is important that if you have symptoms, you or your employee should be tested to know, so that you are not continuing to spread it. And so I think our testing capability will continue alongside, in parallel with the vaccination efforts. It is incredibly important that we continue to make sure folks who think they may have it or have symptoms are tested.
Okay, that's tremendous. We've gone a little over. Again, I think that these topics are still really important and relevant. The Chamber will continue to do these. We did business briefings, all sorts of at the beginning. If you have ideas, or you think that we should do another one of these where we can get into some additional issues about workplace, we'll happily do that. That's what we are here to do, and that's how we have been serving you for 18 months. I want to thank our panelists, Deana and Kate, and Jeff and Chad and Debbie and Kamaria. Jill, thank you for kicking us off. This has really been a great panel. I'm going to turn it over to my colleague, Thomas Deere, who is going to send us home. Thank you, Thomas. Take it away.
Thank you to this amazing panel for today's discussion. It was incredible. I hope everybody found this valuable and have information you can share with your teams as well. On behalf of the Cincinnati Regional Chamber, I'd like to thank the African American Chamber, the Greater Cincinnati Foundation, and the United Way for their partnership in today's event. In closing, a huge thank you to our members and guests for tuning in today. The Chamber is focused on helping you and your businesses thrive today and in the future. Know that we, the Chamber, are here for you. For those guests, we welcome the opportunity to share all the benefits the Chamber has to offer. Please find us at cincinnati-chamber.com/membership. Thank you and have a great day.